Away from that, over 600 private hospitals will suspend Social Health Authority (SHA) services starting Monday due to outstanding payments. This comes after the government's failure to clear debts left by the now-defunct Nhif and ongoing challenges in SHA compensation. The Rural and Urban Hospitals Association is demanding the settlement of 30 billion Kenyan shillings owed to hospitals and the improvement of outpatient service compensation under SHA. Our reporter Florence Simeyo now reports.
The Private Hospitals Association in both rural and urban areas have issued a warning about impending crisis in health sector, citing the decision to suspend services for patients under SHA starting Monday.
We deeply regret that from Monday, 24th of February 2025, patients seeking care under SHA will need to make cash payments at private hospitals across Kenya. The SHA outpatient reimbursement model, which proposes to pay a hospital less than 75 shillings per patient per month, is completely unrealistic.
They stated that the government's failure to address critical challenges have made it increasingly difficult to sustain hospital operations. According to the associations, 89% of hospitals have reported that SHA claims portal remains non-functional, preventing the process of reimbursement. Additionally, they revealed that 54% of hospitals have not received any SHA payments since December 2024, while outstanding claims from the now-defunct Nhif dating back to 2017 remains unresolved.
89% of hospitals reported that the SHA claims portal remains non-functional, making it impossible to process reimbursements. 54% of hospitals have not received any payment from SHA since December 2024. This situation is worse.
Rufa highlighted that the hospitals are facing high turnover of medical personnel due to their inability to pay salaries, resulting to massive job losses. They also noted that many hospitals are struggling to repay bank loans, further worsening the situation.
We have had massive job losses. Many hospitals have lost doctors, nurses, and support staff due to inability of these hospitals to pay salaries. Number two, hospitals are facing bank defaults.
Meanwhile, the Carcasses of Health Sector Union and associations has accused the government of planning to merge the regulatory bodies. They strongly oppose any such proposals, arguing that the independent healthcare regulatory bodies are essential for strengthening training and ensuring professional medical practice.
We stand here to resist any proposal to merge healthcare regulatory bodies, which ought to stand alone and ensure that we strengthen our training and also the practice of professional in respect to their line.
The unions have demanded that the ministry and the parliament immediately and completely abandon plans for declassification, defunding and merging. They warn that the failure to comply within 14 days will result in a strike notice, followed by industrial action.
The ministry and the parliament must drop the issue of declassification, defunding and merger with immediate effect and in totality. Yes. And if they do not do this within the next 14 days, then all of us shall issue a strike notice and proceed on strike.
At the same time, nurses under the Universal Health Coverage Program from Busia, Kakamega, Bungoma and Vihiga staged protests against the government's failure to employ them on permanent and pensionable terms. The nurses emphasize that the universal health care cannot be achieved without absorbing experienced personnel. They urge the government to prioritize their employment rather than hiring new nurses while leaving them unabsorbed.
5 good years unafanya na watu wenye wako PNP. Wewe mwenyewe uko tu hapo contract. Hakuna kitu, yani unapata peanut.
Universal health care will not be realized if you are not employing these nurses. We are saying, please don't bring in any other nurse. Yet these ones already they have the experience.
Reporting for Tandao News Outlook at 1, I'm Florence Simeyo.